over and over and over and over again, they needed to brush their teeth. And so we would say, how you want, for everyone listening, how you want your future, your access to healthcare. Think about things like your kids and grandkids and then their kids. It's really really important who we elect, and that's just a really big deal. Jaden, you had a question. You had a question for Jinan. You were mentioning.
Yes. So, what role do you believe? Um, what role do you believe that a judge can? I'm forgetting the order I was going to ask this in. Okay, there we go. What role do you believe a judge can play in advancing public health initiatives in our local communities?
So, judges are elected officials, and as such, they are a part of our government as a whole. And there's a distinction between legislation because judges can't create legislation. Trial court judges, especially, they're tasked with following the law, and then if the law is to be challenged, that happens in the higher courts. As a whole, I think that being as the judiciary is part of the government, our government as a whole has an obligation to prioritize and improve healthcare for our population. And I think that it's a judge's responsibility to do their part using resources they have access to in order to promote the health and general wellness of those they serve in local communities. And what judges can do is look to agencies they partner with, like community mental health or other public health agencies, and be aware of the programming that's available. A judge can order that a person receive mental health treatment, receive substance abuse treatment. A judge can order parties in family court to participate in therapy, co-parenting therapy, wellness therapy. A judge can make these recommendations in other formats, but just partnering up with the agencies that are government funded and available for these specific purposes and being aware of when to use them. Our county has more treatment courts than most, and we are lucky that we have a sobriety court, a mental health court, a veterans treatment court, and each district court has their own sobriety court right now currently that they have access to sentence those that are justice involved to that programming. And what it provides is long-term oversight, financial support, assistance in getting jobs. All of these things have an impact on the wellness of members of our community and would have a positive influence on the wellness of our community as a whole. I could go on and on about what I, how I think that under all circumstances, I think that every type of healthcare should be made available to our population. And legislation, that is something that the policymakers have a say in. How it's applied is usually within the court's discretion and when to apply it. But again, if there's something to be challenged, that happens at a higher court level. And you've seen lawyers challenge various provisions, rules, but as a circuit court judge, you're tasked with applying the law, but you can also always supplement by using the resources I mentioned.
So for people that aren't from, I was today years old when I looked this up. What is the difference between circuit court and district court?
So the circuit court, we have three district courts in our county, 14A, which is divided into A1, 2, 3, and 4, and it covers 14A2 covers Ypsilanti, 14A3 covers Chelsea, 14A4 covers Saline, and 14A1 covers the rest of the area aside for what 14B covers in Ypsi Township. And then you have the 15th District Court that covers the city of Ann Arbor, and you have our circuit court. And there's one circuit court for the county, And the primary distinction between the two is that district courts handle misdemeanors, um, civil matters where the the amount in controversy is under $25,000, landlord-tenant cases, and the small claims courts operate out of the district court. The circuit court handles felonies, the juvenile court, family court, and civil matters that are in excess of $25,000. In our county, our probate court is in the same building as our circuit court, and we have a unified court. So some of the probate court judges also handle circuit court dockets.
So is it fair to say that circuit court is over the entire county,
That's correct.
and so what you're running for circuit court judge, and if you're elected, that means you would be handling some of the larger cases. Is That's in layman terms kind of how I understand it. Is that close?
That's correct. Yeah.
Okay, very cool. So that's helpful. I was just talking today to somebody who was licensed in another state, and Michigan has different laws, and they're not recognizing her physician license because of how it was in another state. And I thought that's interesting that I had that conversation today, and we're having this talk tonight. So how do you think judicial decisions can impact access to healthcare, especially when it comes to I don't like referring to it as alternative care, but sometimes in accepted language, the distinction would be complementary and alternative medicine. I don't like that term at all, but that's kind of what the people that are a bigger deal than me have decided it should be called. But so anyway, basically for everything except drugs and surgery, that's how can that impact healthcare when it comes to accessing things that are not drugs and surgery, not FDA involved, not large system involved? Would you being judge have any impact on that?
So it's kind of a tricky question because the judicial canons of ethics prohibit judges from giving an opinion on potential rulings that they might have to encounter in cases that they may have before them. As a whole, like I said, I think government needs to prioritize the population's health and access to health care. And I think that it's important to include all types of health care in that. As an attorney, I have clients who have asked me to litigate, for example, in family court. One parent wants a child to get a COVID vaccine or any vaccine, and the other parent does not. And the only thing that a judge can do is, well, first you want to try to see if the parties can work it out. And then a judge would have to hold an evidentiary hearing and use a best interest analysis, just like they would do on a decision that impacts a choice of school or, whether a parent can move. And they would just have to apply that analysis based on the facts presented to them and make a ruling consistent with the controlling law. Judges really cannot affect legislation, but I think, in a case-by-case scenario, a judge has to review the circumstances presented and consider everyone's position, make sure they're being heard, and then rule accordingly. Changes to the law, again, come from people challenging the law in legislatures, legislative changes. So the judge's impact is limited, is I guess what I'm trying to tell you.
Yeah, that's so it was I read a book called The Real Anthony Fauci, and this isn't designed, the question or statement I'm making is not designed for anything other than to point to how government can have, any branch can have an impact on health. But Robert F. Kennedy Jr. said that Fauci generation, children born after Fauci's elevation to NIAID, that's the office he oversees. He got that position in 1984. What statistics are showing is that it's now the sickest generation in American history, and it's made Americans among the least healthy citizens on the planet. So, and then from a political standpoint, Robert F. Kennedy Jr. said that basically his interactions with agriculture and big food and pharmaceutical companies have kind of overlooked the children. He said they're drowning in a toxic soup of pesticide residues, corn syrup, processed foods. So my question is not really any opinion on what he's saying specifically, but on how much trusted institutions how much power can trusted institutions have, and how much, what kind of say might you have in that? That's probably a better way to answer or ask it.
Here's what I will say. This is a question I get asked all the time. What, sometimes a judge has to make a decision that may be inconsistent with what a judge values, to the effect that if there's a conflict in the law between the law and your values. And judges have an obligation, it's a duty to set aside any personal bias they might have on any issue and consistent with the law. So, if you have a judge that is imposing their personal values, what they might do for their family or their loved one, and it's being applied inconsistent with the law, that judge is not doing their job.
Yeah.
So, you set aside bias, you rule within the law, and that's basically the judge's obligation. If the judges recognize something that may be causing hardship, they will try to work within any exceptions that the law provides to grant the appropriate relief. But at the end of the day, they're stuck with what the law says. And I'm sorry if you heard my daughter. She just came in here and whispered in my ear.
That's the coolest. That's the most important anyway. All right, Jaden's got one more question, Jinan, and then we'll give you closing remarks, and you can tuck the kiddos in.
Thank you.
Right. My last question is, how does wellness fit into your broader vision for the community, and how can the judiciary support healthier lifestyles?
Thank you for that question. Again, I think that, the old school cookie cutter approach to our legal system, which I'm proud to say is changing, was very harmful to the wellness of the litigants that would appear in court and to the community as a whole. There's so much more appreciation now for recognition for mental health issues, for substance use issues, and the drive to provide the supportive resources to people with disabilities, to making courts more accessible, more approachable, to making it not a place that you're scared to go, and a more of a problem-solving space than a space of punishment. And the more access that you can have to treatment court resources, in my opinion, the better. In our juvenile court, we have a lot of restorative justice programs, diversion and deferral programs, and we recognize more so now than ever that kids these days are going through some really difficult experiences, and if we don't identify what we can do to support them, they're more likely to reoffend or offend later on in life. We've recognized the stress that divorce proceedings have on children, and it used to be this is the rule, this is the order, kids have to follow it, and now kids have more agency in addressing some of the resolutions that are reached in family court. But starting with that as a base, what is bringing you to the court, and is there something from a wellness standpoint that we can help you fix? And you may not have the money to do it. How can we do that? There's a program called Supportive Connections at 15th District Court, for example, that will approve rent for somebody for the first month if they're in transitional housing, or if they're in some sort of, there's another program called A Brighter Way that takes youth offenders and provides them with housing and mentorship from other adult offenders who may have been convicted of felonies and successfully completed whatever probation or parole requirements they had, that want to mentor the younger kids. And so let's say you have a defendant who pleads to something and is allowed to live with someone at Brighter, is allowed to be connected to Brighter Way. They need to pay for their first month's rent. You reach out to Supportive Connections at the 15th District Court and see if they will pay for their first month's rent. Then the mentors at Brighter Way will hook them up with someone that will teach them how to fill out applications, do follow-ups for interview callbacks, and will kind of give them guidance and the additional support to, find employment. And we know that financial stress also causes sickness, and try to teach them how to become more financially stable, or give them opportunities to do that. And then they'll make sure they're going to their therapy, their treatment, taking any prescribed medications. It's a total community effort, these types of programming. Judges have to really get behind them and be supportive of them. Legislation has to affect them and provide funding for them. And the community as a whole has to want this type of approach to our legal system, this restorative, healing, focus on health and wellness approach. And when the community gets behind it, then it makes it easier for legislation to pass, the laws they need to make, for the government to fund the programs, and for judges to use the program. So it's all full circle, all hands on deck community effort.
That's huge. We did my family, my wife and I, we did foster care for 6 years, and I was in practice at the time, and there were so many rules about what we could and couldn't do with the 6 kiddos we had come through our home. And one of them had really significant birth trauma, and then was physically abused. And we got him when he was 4. And I, did some scans on him in the office. We take care of a lot of kiddos in there, as if you've listened for a minute, you'll hear about that a bunch. And we actually got kind of reprimanded by the department because we didn't have parental consent to provide, to take him for any of that care. And I'm not saying that, I say that kind of neutrally, but I just thought, oh my gosh, like there are a lot of things at play here. And so who we elect is a big deal. It's not just this, passive blase thing. We have to take it seriously. So Jinan, I'm going to give you closing remarks. If you could just share your closing thoughts on the importance of balancing justice and public health, and of course, mention how listeners can learn more about your campaign.
Yeah, thank you. Thank you so much for inviting me to be on. And your questions were very thoughtful. This is a more unique setting for me to be speaking in too. But the two really do go hand in hand. And I watch people struggle through their court cases, and I see the impact it has on their health. And sometimes you have to do. We have wellness checks for a reason.
Sure.
You have to. It has to always be at the forefront, because we're dealing with human beings, and whether it's emotional, physical, or mental, their health is at issue when they're dealing with a court case, or if they're a defendant in a criminal case. And recognizing that, making sure that they're okay, asking them what they need. Just basic, simple things that you should do as a human, but you have more resources to maybe provide if it's available to you and appropriate in whatever case you're dealing with. I think that always has to be at the forefront, aside from just doing the typical the typical court administration or the typical justice administration or legal system administration. We are dealing with people, and people need to have things to support their mental, emotional, and physical well-being.
Absolutely.
Sometimes I feel like I rabble, I can't even say the word, just go on. So I apologize for that. It's hard to find the right words spur of the moment.
Not at all. No, I think that was beautifully done. Jaden, any last thoughts?
I will say that I don't know if I'm supposed to say attorney or lawyer, or if there's a difference.
Nope, they're the same.
But as far as I know, Jinan on a personal level, and she takes just the amount of care she'll take of anyone whose case she's working on is amazing. She makes it hers, and she takes care of you. Amazing, and I'm very grateful and thankful for you, Jinan.
Thanks, Jaden. And you did bring up something that I think I say this all the time. It's all over my website, and I can't believe I didn't mention it today. But compassion and empathy are a lawyer's greatest tool, and they are also a judge's. And this is what I meant by dealing with people. I mean, sometimes somebody could just be on the verge of a mental break, and all it takes is someone saying, "Are you okay? What do you need?" And judges have the power to do that. They're not just reading a case file, running through a docket. They're interacting with humans on a daily basis. Taking that time out to treat them like a human, I think the best judges do that in their courtrooms.
Well said. That's very cool. Well, Jinan Hamood, your website again is it Jinan for Judge or Jinan Hamood for Judge? I've already forgotten.
That's okay. It's Jinan for Judge. Well, this is how I'm a millennial. They always make fun of me when I record, and they say stop saying www. It's JINANFORJUDGE.com. I also have a Facebook page, Jinan for Judge, or Jinan Hamood for Judge is the Facebook page. I think I'm the only Jinan in our county. So if you just look up my name, all these websites will pull up.
That's very cool. And you are running for Washtenaw County Circuit Court Judge. Is that?
That's correct. And you need to remember to vote the nonpartisan section of your ballot. So
Yes.
if you check off one party or another, you're not going to be voting the nonpartisan section, which is where all the judges are.
All the judges are nonpartisan. That's right. So I'm glad you mentioned that. That's a great service to mention that. Jinan Hamood, thank you so much for your time. I know you're extremely busy, so we will wish you well, and we're excited to see the outcome of the election and hope to have you as judge in our county. Thanks for being here.
Thanks, Dr. Lazar. Thanks, Jaden. You have a great night.
Thank you. You too.
You too.
Bye.
Bye-bye. If you're just tuning in, this is your weekly checkup, 866-521-WELL, 866-521-9355. Great conversation with Jinan, huh?
Yes.
We've not ever had a discussion like that on here before, but you've shared your story on here, Jaden, and Jinan is currently actively helping you
Yes.
with your case. Although if she becomes judge, that'll have to change, I guess. But I only say that because that's how we have gotten to know her, and compassion and empathy. Beautifully said. I've met judges over the years, and I'm sure they all mean well, but I've not met anyone as humble and compassionate and with as much empathy as Jinan. So, I think it's really important that we give honor where it's due. All right, we're going to take a short break. We'll be back right after this. Welcome back to your weekly checkup. I'm Dr. Lazar, excited to be with you tonight, and we are talking about the role of justice and public health and all the things. In our last segment, we had Jinan Hamood on, and we had a conversation about where her connection and how she sees the role of community leaders in promoting public health. So great conversation, and JinanForJudge.com for that. You know, judicial and political leadership really influences public health policy. And when I talk about public health, a lot of times people don't associate chiropractic care with public health. Here's why it's such a relevant conversation. The Spanish flu of 1918, 18, 19, 20, 21, whatever, around 17 and 18 is when it swept the hardest. And what the world doesn't understand is the millions of people that died from that was a scary, overwhelming thing. And it was we have the role of history to help us as we were going through COVID stuff. And we had a lot of confidence through that. But chiropractic and public health is a really strong connection because, for example, people who are under regular chiropractic care on a maintenance basis for 5 years or longer, and people think like, what the heck, 5 years? Well, you've been going to the dentist longer than 5 years. So you're totally okay with maintenance. Take 85% less prescription drugs.
That's a big number.
That's a huge number. That affects public health big time. 60% less hospital admissions. That affects public health a ton because the hospital is available to help other people who are sick. If people who are under regular chiropractic care for 5 years or longer on a maintenance basis are hospitalized 60% less than the rest of the population, then we as chiropractic patients, lifetime chiropractic patients, can free up the space for the people that need access to sick care. That's a huge impact on public health. But statistics about the 1918 flu reflect a most amazing, miraculous state of affairs. The medical profession in 1918 was practically helpless with the flu victims, but chiropractors seemed able to do no wrong. That's a direct quote. So in Davenport, Iowa, where chiropractic was discovered and the first chiropractic school, Palmer College of Chiropractic, that's what it's called today. There were 50 medical doctors, and they treated 4,953 cases, so about 5,000. And within that people group, there were 274 deaths. So influenza 1917 and 18, about 5,000 cases treated by medical doctors, 274 deaths. In the same city, 150 chiropractors, including students and faculty of, at the time, Palmer School of Chiropractic, served 1,635 people. So Jaden, let's revisit the numbers again. So in Davenport, Iowa, 50 medical doctors took care of about 5,000 people, and how many chiropractors?
150 chiropractors.
So 3 times more chiropractors were there. Now here's how this is set up. At the time, the medical profession was directly targeting the chiropractic profession among other professions, naturopathy, homeopathy, osteopathy, and saying that everyone else is trying to practice medicine without a license. The chiropractic profession, in fact, they were jailing chiropractors. And the chiropractic profession was saying, no, we're a separate and distinct profession. We're not breaking the skin. We're not doing surgery. We're not providing drugs. So we're not practicing medicine at all. So 3 times the number of doctors of chiropractic helped, and 1,635 cases during that time in Davenport. Out of 1,635 cases, Jaden, how many deaths were there?
1. Only 1.
That's insane. So here's where we're going with this. So that was in Davenport, Iowa. In the entire state of Iowa, medical doctors treated 93,590 patients. almost 100,000 patients, and there were 6,116 deaths. So if we, Jaden, if we break that down, let's see, 6,116 out of 93,590, that's about, what do those numbers kind of boil down to?
About one patient out of every 15. A loss.
Okay,
So it
so
would be a loss of one patient out of every 15.
so 1 in 15 died
Mm-hmm.
from influenza and or pneumonia. Okay. Also in Iowa, excluding Davenport, because that was counted above, 4,735 patients were under the care of chiropractors. And how many people out of that 4,735 died?
Only 6.
So that's a loss of one patient out of 789. National figures show that under chiropractic care, the deaths were 1 out of every 886.
Wow.
So we can keep going, but here's the point. For influenza, under medical methods, there were 950 deaths per 10,000.
Okay.
Under chiropractic care, there were 25 deaths per 10,000.
Wow.
For pneumonia, under medical care, 6,400 deaths out of 10,000. That's a 64%. That's a 64% death rate. And under chiropractic care, there were 100 deaths per 10,000.
Wow.
64% versus 1%. So
That's crazy.
when we look at that, we may not feel that or understand that but when people are trying to shut down the profession back then at the time, because of how effective this was, like 1% of people under chiropractic care. And here's the thing, how it was set up was that patients were triaged. So they were put into 4 different categories, and category 1 was the most likely to survive. Category 2 was next. Category 3 was, even less likely to survive. And category 4 was left for death. I didn't even mention this in the numbers. The medical doctors would not allow chiropractors to take care of patients anywhere near them, and they couldn't take care of categories 1 through 3 triage levels. So the only people the chiropractors took care of were the ones that were left for dead. That's why the numbers were so much smaller of the people they were able to take care of. And so they got the worst of the worst cases, the ones completely left for dead. And for flu, it was 1/4% deaths. And for for pneumonia, it was 1%. The sickest of the sick, completely left for dead. Chiropractic care did. Now, the magic in this is that chiropractic simply allows your body to function the way God designed it. Chiropractic didn't save these people directly. What chiropractic did was worked with the nervous system, which controls the immune system. And when your immune system gets stronger, things like influenza and pneumonia don't kill you. I mean, that's the direct connection there. So that's powerful, isn't it, Jaden?
I've heard this story so many times, and every time I hear it, I still get chills. And I just want to point out that this outcome to me is not surprising at all, because it's exactly what should happen when your body is functioning properly and with no interference and with your full God-given potential. And so every time I hear this story, I love to hear it. I get the chills. It makes me so excited. But it's not surprising to me, because I know and I believe that is the outcome of chiropractic care.
Absolutely. Well, you see it all the time and you live it, and you've been under care, and your son has been under care since he was 30 minutes old. So you're seeing that. But think about how much confidence people had in going to the chiropractor with that sense of certainty that, I mean, if we average 0.25% and 1%, oh gosh, I shouldn't have done that because I don't know the number. Let's say 0.6%. I don't know.
Of what?
Average. So if there's 1% and 0.25%, that'd be like 0.55 or 0.6% or something. I'll do math on the break. But anyway, that is an average of less than 1% of people that were left for dead died when they were under chiropractic care. That is some certainty. That is some conviction. That is some great willingness to fight for a cause. And that's why we need to be aware of it. That's why we need to be under care. That's why our community needs to be under care. That's why you need to tell your friends and family. You know, think about if you're under care and you know what this can do for you, you would bring people with you, right? You want your family and friends to also be healthy. There was an initiative in our area, Southeast Michigan, Detroit's Healthy Kids, Healthy Communities program. Did you want to share on that, Jaden,
Yes,
the
sure.
stuff around Detroit?
Yes, so this initiative, it brought together local leaders, health professionals, community groups to create environments that promote physical activity and access to health foods. And this, the program had a positive impact on reducing childhood obesity rates and improving public health in Detroit.
That's huge. So physical activity, that doesn't cost us any money necessarily. I mean, you can run outside or whatever. Access to healthy foods, that can be a challenge because when budgets are tight, it's the processed food that's the cheapest. So healthy food is definitely a challenge, but physical activity and access to healthy foods, those are life-giving. Now on the flip side, if we look at negative outcomes where justice or the legal system or government in general, any branch, negatively impacted community health, would be the Flint water crisis, right? I mean, that was a failure in leadership. That was a public health disaster. Thousands of Flint residents were exposed to lead-contaminated water. That was leading to Legionnaire's disease. I mean, those are devastating effects when leaders neglect public health and they prioritize cost saving over community well-being. That's why who we elect matters. That's why you have to vote. You have to vote. I read a statistic recently that 18% of Christians aren't planning on voting. You guys,
Why?
we have to vote. They're saying they don't like any of the candidates, and we have to vote. We have to. It's our, if we're going to maintain a republic here, we have to vote. And then also, there were some areas in Detroit, Jaden, you were telling me about earlier. There were healthcare shortages, and I guess it was slow. Government leaders were slow to respond to that. And what happened as a result of that?
So because of them being slow to address healthcare shortages, it led to negative health outcomes such as higher rates of chronic illness, inadequate mental health resources, and limited access to preventative care.
Preventative care is huge. You've heard it said that an ounce of prevention is worth a pound of cure, right? Or better than a pound of cure. The role of judges in health policy, while judges are not healthcare professionals, they can make decisions that affect healthcare access. They can make decisions that can affect worker protections, community health initiatives. There's a big impact there.
So, for example, with judges in the health policy, rulings that impact insurance or regulation, or healthcare facility licensing, public safety standards, they can help or hurt the public health progress.
Exactly. So,
So
that's really well said. I mean, that's why that matters so much. We're going to take a short break. We'll be back right after this. Welcome back to your weekly checkup. Jaden, we've had a great show talking about the judicial system and public health and how justice, wellness, community leadership, specifically because we had Jinan on the role of judges in supporting health and well-being. Again, JinanForJudge.com. If you can find out about her and make sure you get out and vote. So if we think about the legal system's impact on public health, the workplace safety is huge. OSHA, the Occupational Safety and Health Act, that was passed in 1970. That established workplace safety standards. And since that was implemented, workplace fatalities, in the U.S. have decreased by more than 60% while the workforce has doubled. So legal mandates can have a significant impact on public health outcomes by ensuring safe work environments, for example. There are tons of examples of how that's affecting us. And preventative care and the importance of community leaders championing wellness initiatives, that's why who we vote for matters. It's, preventative care, promoting health, not just treating symptoms, but promoting health is a key to reducing the burden of chronic diseases. That'll also improve quality of life, which is kind of cool. And then, of course, we were talking about less hospital admissions, less prescription drugs. That's going to lower healthcare costs. So community leaders, judges, policymakers all play an essential role in promoting access to this type of care by ensuring fair regulations, supporting health initiatives, influencing public policy. That's really big. Jaden, what's the as far as preventative care in the U.S., the CDC talked about that.
Yes, so according to the CDC, chronic diseases such as heart disease, cancer, and diabetes account for 70% of deaths in the U.S. each year. And so these conditions are largely preventable, especially through lifestyle changes, access to early interventions, and then wellness.
Wellness initiatives.
Yes, supported by leaders.
Yeah, that's the thing is, we can either wait for something bad to happen or we can promote health in our lives. In terms of insurance coverage, chiropractic care coverage varies by state and insurance provider. Political leaders play a role in advocating for broader coverage for things like chiropractic. In 30 states, legislation requires private insurers to cover chiropractic care, but there still are a lot of coverage limits. And so leadership advocacy is crucial for people to have broader access. If you think about how beneficial it would be if people were taking less prescription drugs and the less surgeries and less side effects from all of that stuff, it's huge. It's absolutely huge. And, you know, the U.S. Department of Health and Human Services says that every dollar spent on preventative health care on a program like that will yield a $6 return in reduced healthcare costs. That's a 6-to-1 return on investment. So we're serious when we say this. And so there are a couple takeaways as we wrap up. Community leaders, including judges, like hopefully Jinan, play a vital role in ensuring access to healthcare through legal decisions and public health initiatives.
Leadership failures, similar to the ones seen with the Flint water crisis, have devastating health consequences, while positive leadership, as demonstrated in the I can't think of the word right. Yes.
The ACA did preventative care.
Yes, the preventative care policies that will significantly improve health outcomes.
For sure. Listen, we appreciate your time on behalf of our team in Ann Arbor and in Troy and our awesome team at WMUZ. Thank you so much for joining us tonight. Jaden, we'll be back next week talking about
sciatica.
Excellent. You don't want to miss it. Thanks for joining. Have a great night.
God bless.
WMUZ FM HD1 Detroit, 103.5 The Light, streaming online at WMUZ.com. Detroit made, Bible strong.
All right. If you were joining us on social, Laura, we see you in there. Thank you so much for joining. And Jaden and I had a really cool show. We appreciate you guys joining. Appreciate your support. And make sure you get out and vote. God bless you guys. Thanks for joining. Have a wonderful evening. And tell a friend about chiropractic. It'll be you'll be glad you did. Have a great night, guys. Thanks.